Right, I'm starting recording now. Does anybody have any questions first before we get going? Anybody got any questions? You can either type your question or you can raise your hand and I'll turn your microphone on. Anybody got any questions before we get going? You'll have the opportunity to ask questions after each letter, okay? I've got about 9 from the group. Well, seems nobody's got any questions, let's get going. So I'll share this. Where are we? Right, can you see this? Can you see this letter here? Yeah? If you can see it, somebody type yes in the chat box. Yes, okay. So I'm going to put the changes on as before. Okay, now, I don't have a case notes. I don't have time. I'm not going to be doing an in-depth analysis of all these because there's like 9 and that'll take an hour at least. So first things first. So this is Ahmed's. I suggest that you turn your cameras off so we don't want to see you. Okay, so this is Ahmed's. First thing first, well, you've misspelt that. To request investigations. Why is investigations? Why is that plural? Investigation, or is it tests? Now, you've got to watch investigations because that's what detectives do. Investigators investigate. You can request tests, possible investigations if you're not really sure what is going on. Anyway, investigations, okay, if it's plural, okay, you've got to be careful. A treatment plan for Seaman's picture consistent with grant. Okay, that's a good introduction. Mr. Seaman's medical and social history, he has been suffering, that's good. Present perfect continuous, that's good. Since 2010, good grammar. Also a heavy drinker, he has a family history of rheumatoid arthritis. Now, that's not bad, not too bad, right? I was talking about this yesterday in a video about the importance of having introductory phrases or gambits in front of the paragraph. This helps the overall flow and coherence. So that's not bad. Okay, Mr. Seymour presented before history of what is that, Anne? Attack of gout, which was a third attack in the previous 8 months. His examination revealed I hope these are typos and not spelling mistakes in this first letter. So, who reported, right now, not being compliant. Now, first thing, not being compliant or not being compliant, that's the word. Comply is the base form of the verb. However, current advice is not to compliant because it implies a shifting patient-doctor relationship. So we are or have been advised to use adherent. But however, would he really report, I have a report to make, doctor, I am not compliant? Well, no, he would simply state, or he would say, he mentioned that he doesn't take his medications. Would he really say that? Would he actually come in and say, doctor, I must report, I confess? Well, no, you would probably ask him. So upon questioning, he mentioned that he's not being adherent. So, he's not going to walk in to the office. It's not like in the army. It's not, we're going to walk in, doctor, I must report. Well, no. So upon questioning, he mentioned that he was not adherent. Okay. As a result, I advised him to okay, this is kind of obvious. He says, doctor, I don't take my medicine. So you say, well, you really should. Okay. Decrease his alcohol intake and modify his diet. Okay. It's just, that's kind of obvious, really. He said, I don't take my medicine. So you said, you must take your medicine. Okay. Additionally, paracetamol, oxycodone, or codeine were prescribed. Today, Mr. Simmons' gout episode was subsiding. Was subsiding. Now, that means it was subsiding at the moment that he was in the office. So I don't know if that's true. Had subsided, past perfect. So it had subsided from the previous visit. I think that's better, because if you're using was, that implies it was an action in progress. So he came into the office, and while he was standing there, his episode was physically subsiding. So I don't think that's the case. So I would probably make it past perfect. Had subsided. Okay. Now, his investigations, he didn't do any investigations. His test results showed. But he didn't, unless he's a private detective, I don't think he personally did any investigation. So his exam or his test results showed high levels of etc., etc. And his X-ray detected minor changes. I don't know why that is capitalized. I see that the next episode was, how can you encourage a fluid sample? You can encourage a cat to chase a ball of string. You can encourage someone to do their homework. But how can you encourage a fluid sample? So that doesn't make sense. You encouraged him to have a fluid sample taken. That makes more sense. Encourage him to have a sample taken. Okay. Now that, okay, but you can't encourage a fluid sample. Oh, okay. However, you want it to be referred to I presume that's a traumatologist, is it? Traumatologist. Please not copy the result of what? Of the result of what? Of a football match? What result? Are you talking about a copy of the test results? Okay, then you should say so. In view of the above, if you could take over what? If you could what? So if you're using if as a conditional, what's the second part of a sentence? In view of the above, I would appreciate it if. If. Okay, now it makes sense. Okay. So there's a few things here we need to work on. Right. I don't know if Ahmed's, is this, no, Ahmed, is he here? Maybe not. Anybody got any questions on this one? There's a few logical inconsistencies. Ray, not you again. What do you want? Oh, all right, man. Ray, I'll turn your microphone on. I'm trying to turn it on. Yeah.
Can you hear me? Hi, Kevin.
Yeah.
Yes. Sorry. I have another question. In this case note, I mean, in this letter, there is a sentence. If you can check this one, is mentioned that a 4-week history of gout. Okay. As you mentioned before, I've checked with another letter. You mentioned that it's not a proper phrase, and you can change it to another one. For example, with an attack of gout lasting over the previous 4 weeks.
Yeah.
Which something? That's it. Which one is better? I mean, is it correct, or we have to change the other one?
Well, I reworded one in a previous letter. I can't remember what it said exactly, but sometimes it can be worded correct. I can't remember the particular letter in question that you are referring to. But this one here, it's okay. A 4-week history of an attack of gout. So this particular attack has lasted for 4 weeks. So that's perfectly understandable.
Because exactly it was my letter, and I mentioned exactly the same, and you told me that it's not fine, and you can change it to the other phrase as I mentioned for you.
I can't remember. Maybe I don't know if you phrased it exactly the same as in this one, but this one is okay. You can say that 4-week history of an attack of gout, or he presented with a attack of gout which had lasted.
Okay, you know that because it's very common. It's very common situation, because mostly there is a symptom with the lasting time. There is a time taking. Okay, so it's very common, and we will face the same problem in any letter. So if it's okay, so we can go for this type. If the other type is okay, so because I changed my mind to the other one which you mentioned before, and I changed it to the other one, and I thought that this was you think that it will be an error, but you told me
as long as it's clear. So again, I can't remember the exact phrase that you used, but some of them work, some of them don't. It depends on preposition use and syntax, the order of a sentence. But this particular one here.
Yeah.
This isn't, it's understandable. So, in a 4-week history of an attack of gout, you could, say, presented complaining of an attack of gout which had lasted for the previous 4 weeks. So you could use past perfect.
Okay.
There's more than one way of talking about a past event. And they do want you to use a range of structure. But anyway, but this particular, particular letter is not too bad. It's just a couple of things, as I mentioned, was not as clear as they could be. So let's move on, because I've got another 8. I picked some, and I think it was like, I don't know, kind of 9. With that, I don't know if he, she. With that, maybe not. Okay. Mrs. Ann Howard, writing to a 34 mentioned patient who has been suffering from left abdominal pain, as well as evaluation for further management, assessment and evaluation for further well, what is it that they require? Do they require further management and assessment or evaluation? So, when you see this kind of thing, I'm always tempted to, keep it as simple as possible and say something like, I am writing to request assessment and evaluation of Mrs. Howard, who has been suffering. And that makes it easier, I think, to understand. Instead of the aforementioned patient who has been suffering and requires assessment and evaluation for further management. Now, I don't know if we could break this up, but the question of that, further management, yeah. So I would try and simplify this, make it a little bit easier. So I probably do it something like writing to request and eval, or I'm writing to request the assessment and evaluation of Mrs. Howard, who, and then get rid of that and get rid of that. Okay, there we go. Writing to request the assessment and evaluation of Mrs. Howard, who has been suffering from left lower abdominal pain for the past 4 days. Okay. Regarding her past medical history, Mrs. Powell's last menstruation. When is this? I'm not sure of the case notes, but something seems amiss Her last period was in 2006. I don't know if this is an old letter or not, if anybody's seen this. Last October 2006 and 2007. I presume it's an old one. Okay. She was presented in hospital. She was presented. Okay, okay. Now, use of passive implies that someone presented her. Now, that could be true. That could be true. But usually people go themselves. Now, so it's kind of tricky as to who is doing what here. So, you know, she was presented implies that someone took her. And here is Mrs. Howard. But I don't know if that's true, whether she went herself. I think that might be the case. Again, without seeing the case notes, it's difficult to say. But just in terms of grammar, okay. She presented with the complaints of general bleeding and abdominal cramps. Okay. So where's she presenting to? So she went to the hospital. Okay. So again, without the case notes, I don't know if she's coming to the GP or presumably presented to the GP, to the writer. Okay. Well, sharp on the pain on the side. So was parallel. I had the motion. Still was noted. Why is that? Why is that passive? Why is there a mixture of active and passive in the same sentence? She reported that she had had no bowel motion, but hang on. So a hard stool, isn't that a bowel motion? But here it says there was no bowel, and then it said that she passed a hard stool, which was bright red. So that's somewhat confusing. I'm not really sure what is going on there. And why was it noticed by her? Why wasn't it she noticed? So this sentence is not so good. This is somewhat confusing. I'm not sure what is going on. So first it says she didn't have a shit. Then it said, oh, but she did have a shit. And it was bright red. And it was noticed by her. So why is it active and passive in the same sentence? Well, that needs a bit of changing. On 21st, Mrs. Howard's pain got worse. Well, okay, you can use got, but it's a bit informal. Became is a better verb, I think. The examination was, her abdomen was tense. Okay, okay. Now tense. Do you mean it was like tense as in it was tight and taut, like a football, like a melon? You know, it was like tight or taut, or tense, because tense can also mean anxious. You know, so not quite sure which use of that is. Although there was no bowel action or phletus reported, or she did not report. Okay, what the bill presents is possible cancer. It's in the management. Okay, okay, so that's not bad. This sentence here is not so clear as it could be. That's all I'm saying. Okay. Now, anybody got any questions about this? Anybody apart from Ray? Of course. Well, no. If you've got a question, Ray, you can ask. At least someone is asking questions. Anybody got any questions about this? Even Ray. Anybody? You can put your hand up and I'll turn your microphone on. I'm only joking, Ray. You know. Anybody got any questions? No? Right, on to the next one then. So here is Dr. Idris. Let's have a look. Okay. I'm writing to refer Mrs. Walter for urgent assessment of depression with suicidal thoughts. What? She is for urgent assessment. Who is right? How can you assess the depression? You can assess a person. For urgent, I'm going to refer Mrs. Walter for urgent assessment, whose signs and symptoms those signs and symptoms are suggestive of, or something such as that. Okay, so Mrs. Walter is a mother of 2 children, and what? Having 2 children makes you suicidal? Well, that could well be true, but what does this have? So, right, I've spoken about this before, about the importance of having a connection between sentences. Don't just drop in a sentence without some kind of correlation or a connection, because this sentence on its own is meaningless. What does that mean? What's the significance of having 2 children? If he said that she's having 2 children and she is struggling to cope with young children, she's not sleeping, and therefore this is one reason why she's feeling depressed, then that would work. But simply saying, oh, by the way she's got two children, doesn't, it's meaningless. So, and also I would put something like, in terms of a social, medical history, etc. Yeah. But just putting that, so that means what? We don't know. Asthma, what's the significance of asthma? Is that doing anything to make her feel suicidal? So you've got to watch it. Just dropping in details, information with no connection to anything does not work. Okay. On a checkup, Mrs. Walter complained of feeling tired. However, her examination was, sorry, got some messages there. Her examination, well, hang on, put some spaces here. We don't need all these but commas. However, her examination was normal, apart from the increased witness index of forehead. She was advised to adopt a healthy lifestyle by reducing weight, or her weight, or losing weight and increasing physical exercise. Okay. 6 months later, Mrs. Walter showed reasonable weight reduction with remarkable engagement in physical exercise. Exercise, how do you spell exercise? Exercise, that should be there. C-I-S-E. And so it was in a children's school as a president of the, don't forget articles, the Parents Association. On view today, Mrs. Walter has significant weight loss, or has lost a significant amount of weight as she lost the desire, articles to eat. She was also unable. So, right. If you're talking about something that's been ongoing for a while, you should be using present perfect. So, she has been. So this started a while ago, indefinite past, and continues to be present. Yeah, because she was also unable to sleep. Implies that she can't sleep now, but the presumably she's not been able to sleep for some time. Hence, that's why she's here. So she has also been unable to sleep or carry out her household duties. In addition, she's failed to cope, or she has failed again, present perfect, indefinite time. We use the simple past when we know a definite time when the past actions occurred. And she expressed suicidal ideation, suicidal thoughts. Well, that's not quite the same. Ideation, nobody uses that word. And she expressed suicidal thoughts, or thoughts of suicide, etc. Given the above information, I believe Mrs. Walter has severe depression with bipolar disorder. It would be appreciated if appropriate. Okay. So this is not too bad. We just need to put some pronouns and articles in here. Okay. Anybody got any questions for this one? Anybody got any questions for this one? Ray, you got any questions? No? Okay then, on we go. Dr. Huda, right, put this up here. Oops. Dr. Huda, are you here? Ah, yes, you are. Maybe you will have some questions later. Brendan, 8 years old boy. Well, 8 years old. We can tell he's a boy by the name of Brendan. Writing with my patient Brendan, whose standard symptoms are indicative of rheumatic fevers coming back to tonsillitis. Okay. He was complaining. Well, what? So he's 8, and he came in and he said, "Oh, doctor, no." So his mother reported that he had 3 days history of etc. Okay, I'm sure. Now, this is a common mistake. You know, when people take their kids to the doctors, and this was certainly the case when I was a child, it's usually the mother, and she does all the talking. The kid in question barely speaks a word. The doctor might ask them a couple of questions, but usually it's the parent, especially at 8, it's the parent who takes them in. "Oh, doctor, can you help my son, Brendan? He's been having," "Oh, really?" And then he might ask. Okay, so I'm sure that Brendan was not complaining of anything. So you need to change that. Brendan came with his mother who reported, etc., etc. Okay, and put the name at the beginning of a paragraph, then you can use pronouns afterwards. Okay, Brendan came with his mother who reported, etc., etc. Okay. Upon examination, there were enlarged tonsils, or he had enlarged tonsils. In addition to he diagnosed. Well, he diagnosed himself. Well, he's a smart boy. Possibly he was, but again. But why is it passive? You examined him, so why is it passive? Didn't you perform the action? Yeah. Accordingly, I diagnosed him as having or suffering from bacterial tonsillitis and prescribed oral penicillin, blah, 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 blah. Okay. In the second visit, Brendan's genitive, possessive, Brendan's condition got worse. So now, got worse. Now that means it got worse at the visit, but obviously not it got worse before. So, I'm a present perfect or past perfect. In the second visit, Brendan's condition had, so I would make that past perfect because it happened before he came. The way it reads here, it got worse while he was sitting there in the office, and I'm sure that's not the case. So Brendan's condition had gotten worse or had become worse. Had gotten worse. He had experienced, now, you've done it right there, past perfect. Why didn't you do it there? Experienced right in joint pain, which is swollen fusion. Mother was concerned. His mother was concerned. Tired, and she was alone. His father. What does that have to do with anything? Where he is, his father was on duty in Indonesia. Well, okay, but you don't have to include that. Just, you know, she was concerned, tired, and she was alone. Well, and what's the significance of this? It's Brendan that we're talking about. I'm not quite sure what the significance of these two sentences are. What that's supposed to add to Brendan's story. I'm not sure what conclusions we're supposed to draw from that. Okay, was a mild, so on examination, so, right. Upon examination, I found, because you did it, I found a mild systolic murmur, hypertrophied tonsils. Consequently, I ordered to do what you ordered who? To do what? I ordered an ECG, ESR, and ESOT. I would try and avoid abbreviations. I mentioned this before. Usually you spell out the term at first and use abbreviations for later use. Okay. Consequently, I ordered an ECG, ESR, and SFT, and advised what? Him to take, advised his mother to give him. That's not complete. And advised, advised, advice as a verb, well, as a noun, advice is a verb. Who are you advising? You advise, we have to have an object. Who or whom did you advise to do what? And advised her to give him, etc. But that doesn't work. Okay. Today's review, unfortunately, he still has the same complaints. The test results showed ECG errors, both condition would be highly appreciated. Investigations, and well, how many investigations is he planning to have? Possibly one. Highly appreciated. Okay. Highly appreciated by whom? Who would highly appreciate it? Well, I'm sure that Brendan would, but he's not doing you a personal favour. So, Dr. Huda, few things here we need to work on. Now, do you want to ask any questions? I can see that you are here. If you type your question, or you can raise your hand and I'll turn your microphone on if you've got any questions you want to ask. Anybody got any questions that they want to ask about this? Anybody? No one wants me to turn your microphone on so you can ask. What's this? Has worsened. Has worsened is like fine. What's where? Has worsened. Well, no, because we can't use present perfect there because there's another visit. We can use it here on today's review or a visit. Unfortunately, Brendan's condition has worsened. We could use it here, yeah. And I forgot to change that. Always put the name first and then the all pronouns, Brendan. Okay. So you can use it here on the same day, but if it's in the past, it would have to be past perfect on the second occasion. Had gotten worse because it's in the past. We've got past event and farther back past event, indefinite time. So past perfect, not present perfect for that one. Okay, right, onwards. Diane, I don't know if you're here, Diane. Doesn't look like it. Okay. Mr. Loris Hoffman, I messaged to request your assistant, Mr. Hoffman's clinical pictures. Okay, now it's good, Let's see. The reader knows exactly what you want them to do. I want you to manage and assess this patient who has, etc., etc. So that's pretty good as an introduction. Okay. Social history, Miss Hoffman. Single, well, if she lives alone, single, lives alone, works as a sales assistant. Okay, is that really pertinent so far? if you were to draw some conclusion from living alone, like she's so alone, she's like, you know, living alone is making her depressed because she's so lonely and sad, then that might work. But again, simply dropping in random facts that you're not weaving into the narrative, it's kind of pointless. Okay. Medical history is unremarkable, so why mention it? She presented a clinic 1 year ago, drinking a large amount of alcohol. I don't think it was a large amount. I think from the case notes, I remember she had a couple of drinks. I don't think she was pissed or anything. Okay. But again, it's like, that's interesting, but is any of this pertinent to the current condition? This looks a little bit short. I mean, we've got a paragraph that deals with the issues, and that's not a lot really, is it? Okay, when we could go, the patient, well, I'll put Miss, hang on, was it? Look, Miss and Mrs. here. What's your titles? What's your titles? I've been typing Miss Hoffman, okay. Then I click with complaints consistent with all facial infection, consistent with infection, which was commenced on systemic and topical. I think of it. In addition, she reported that she had been experiencing sleeping disturbance as well, probably sleep disturbances, poor appetite and depression as well, pulmonary concentration. This looks like a bit of a long sentence. 3 lines, that's a long sentence. Okay. Which is thinking about, for which she's thinking of quitting, about quitting. I don't know if we really need that, but the increased stress. Okay, so we've got one sentence, looks quite a long one. Recent split up with a boyfriend. Well, you know, that does not necessarily mean that she was depressed. He might have been a complete bastard, and she might be pretty pleased that she's not seeing him anymore. So just dropping in facts without, you know, weaving them into the story doesn't quite work. Prescribed for her by whom? Who prescribed it? Was it you? Why is it passive? Okay. The patient acknowledged me. Acknowledged me what? You don't have an object. Acknowledged. Acknowledged what? Acknowledged that she was, but it doesn't take an object. Acknowledged that she was non-adherent with her medications. Again, okay, but she's not just going to simply say, oh, doctor, I'm non-adherent with my medication. She's not just going to walk in and that's going to be the first words out of her mouth. Upon questioning, upon examination, you were talking, and she happened to mention or to say, or you asked her, upon questioning, she revealed, confessed, confession, mentioned that she was non-adherent with her medications. But now, okay, so this, I do know the case notes. It seems a little bit short to look for. I mean, you've got a single sentence for today's visit. Yeah, you've got a single sentence. That's kind of short. You not think? And this is a bit short too. Long sentence with complaints or a complaint consisting which commenced with. Well, I've in my chronic with complaint. I mean, with a complaint consist. You can't really have a complaint. Oh, doctor, I've got orofacial. You wouldn't actually say that. What's the symptoms? Again, I don't have a note. She would come in and say, doctor, I'm feeling like this. You examine her, and then you say what she's got. in terms of structure, you know. So she presents complaining of feeling symptoms. Upon examination, you found that she had, and you did or treated her, etc. So I wouldn't do it like that anyway. It does not. I see Ray's point about that being singular, but that doesn't quite work. She would come in, I'm feeling like this, then you examine or question her, which you then say is etc. But again, I don't have a case notes to hand, so I can't really make too much of a comment there. So not too bad, not too bad. It's just this seems pretty short, a single sentence, and that could be explained a little bit more. And we've got some stuff here that's you're dropping in facts, but they don't seem to be pertinent, or you're not drawing any conclusions from these facts. Okay. I copied this, and it didn't have an address or RE line. I think it's that one. It's Baby Vance. That's the baby who's having some problems. I think it's constipation. I've seen the case notes. I can't remember the wording. Thank you for seeing Vance, who signed the symptoms are consistent. Constipation is being referred to you. No assessment and treatment. Well, okay, thank you for seeing Vance. He's being referred, what I am. So was it passive? So thank you for present continuous seeing Vance, and who is being referred to you. So why is that passive? So if you're thanking him for seeing him, then why are you referring him later in the same sentence? Why not just say, thank you for seeing Vance, who signed symptoms, or thank you for seeing Vance. I'm writing to request your further assessment and treatment of baby Vance, whose signs and symptoms are consistent. You could do it like that, you know. That would be a bit more logical, I think. So I'll probably do it like, I'm writing to request your treatment of baby Vance, whose signs and symptoms are consistent, etc. Okay, I'll probably do it like that. Okay, there we go. Nice and simple. On today's visit, Vance presented with ailments. Ailments? Well, an ailment is a condition. This is probably like a symptom, or, you know, complaining. Presented with the ailments of passing no stool for the last 5 days. No urine output today. Now, I can't remember. Okay. So why do we have today's visit first? I remember from the case notes that his mother and Vance came on 2 or 3 occasions, I think, and his symptoms worsened over time, hence leading to you making a request from the specialist to assess him. You know, so, well, if it's an emergency case, it should have your urgent assessment and treatment of. So that should be clear right from the introduction. If it's an emergency case, I'm writing to request your urgent assessment and treatment of. Okay, and then you can present the chronology of the symptoms, because as it stands here, it doesn't, and why do we have this? What does this have to do with anything? And would you put it here? I probably wouldn't include it, or I would put it, I would stick it here. Some background in terms of history. I would, if you have to include it, right, I would probably put it there. Okay. Then I would probably go through the chronology. Presented a couple of weeks ago, so I can't remember exactly. So what's the date? When did he present exactly? Initially, Vance came with his mother and she reported that, etc., etc. On the subsequent visit, 2 weeks later, his mother mentioned that he wakes up crying at night, wakes up, and has breastfeeding issues. Examination revealed hard feces, I think. Hence, a trial was commenced on. I think in the case notes, the doctor advised her or educated her about expressing milk, or he told her, no, he suggested or recommended expressing milk and trying that. And then he came later. But I think that, wasn't that the first time? Wasn't that on the first occasion when he recommended expressed milk? I seem to remember something about it. So, so either an abdominal examination or his abdominal examination revealed hard feces in it. Well, revealed hard feces, hence a trial was commenced upon. Then you've got his obstetric history, and then in light of the above, appreciated, again, why would it be highly appreciated? Is he doing you a personal favor? Okay, so the layout, I think, needs a bit of changing here to make it more logical. Yeah, that's what I would do. I would recommend that you do the, so right from the start, I want you to urgently see this patient because, etc., etc. Then explain why. First, he came, his mother said, I recommended this. He came back, he had worsened, and then today he came, things are not so good, therefore I'm recommending him, I'm urgently sending him over to you so you can have a look at him. Okay, so in terms of logic, that's what I would do for this particular letter. I would change that because the examiner reading this would not be clear what was going on. Okay, anybody got any questions? I'm going to be wrapping things up in a minute or two. I haven't got time to do all these letters, and I'm sure there are more. Does anybody have any questions about this particular one? I can turn your microphone on if you want to ask. Anybody? I'm just going to do this final letter, and that's it, because I've got other business to take care of. I've got some students coming a bit later. Anybody got any final questions? Or I'll just look at this last letter. Nobody got any questions? Oh. Okay. Barry Jones. So this is the guy that hurt his back, I think. This looks a bit short. Ooh, how many words do we have here? 168. That's too short. 168 words. In the body, they usually just like count, you know. Sometimes they can count this because that's the greeting and a closing, but even then it's like, what, 173 words. That's far too short. That's far too short. But I can see, I remember this one. It's about this guy hurt himself at work. I think he's a forklift driver in a warehouse, and you need his workplace assessing, because he sits down all the time and he has to lift things, and he's bored. He wants to go back to work, but you want to make sure he's not going to make himself worse. So there's quite a bit to put in this, but this one here, it's a little bit short. Assessment of Mr. Jones' workplace work and occupational related incident. Okay, that's good introduction. Mr. Jones presented his back pain and as a result of a heavy box at work. Advised him to rest for a month, exercise daily, and commenced him on painkillers. More time off work and increasing the proximate dose. Now, okay, so the only thing wrong with this is you missed out why he needs workplace evaluation. You haven't told, all right, so I'm the physiotherapy, right? Sorry, I'm the physiotherapist. I'm the assessor guy. But you've not told me why I need to assess his workplace. I need to evaluate his work environment because why? You haven't told me. So he's had an accident. I don't know what he does exactly at work. I think from the case notes he's a forklift driver. So he's sitting down with occasional heavy lifting, I remember. And but there's no mention of that. You don't tell me what he does. You don't tell, well, me, the reader, his job, what he does, nor why I should evaluate his workplace. So in terms of task fulfillment, this wouldn't get very far because half of it's missing. I don't want to be overly harsh, but, evaluate his workplace, please, and I'm not going to tell you why. Oh, okay, so I'll rush to his workplace immediately. Don't think so. So, the bit missing, some information we need to add to this letter. Okay? Right, now, I've been at it for about an hour or so. I haven't got time to do the rest of these. Tomorrow, I will be doing another session. Okay? I think on Friday, it's probably going to be too late, I think. But does anybody have any last minute questions before I go? What type of sentences? Well, they want a mixture of sentences. They want complex or compound because they are more grammatically difficult. It's an English test. We don't want every sentence to be short and simple. I want this, he did that, we said this. That's not what the examiner wants. They want complex only means it's got a main clause and a subordinate. It doesn't mean it's overly long with all, we don't want a run-on sentence. They don't want that, but again, they don't just want a simple, he said this, I did that, etc. They want a main clause, a subordinate clause, joined with conjunctions or commas or semicolons, relative pronouns, etc. That's the kind of sentence that they like because it shows good use of English. And if you're aiming for the B, though you should be aiming for an A, that's upper intermediate. And if you want to be upper intermediate, as a matter of fact, there's a table. Perhaps I should show you what you have to do. Let me just show you something. Just give me a second, people. Well, just find it. Language features by level, CEFR. I'm going to show you something. Hang on a sec. Just give us a second. So I'm going to stop the share. And I'm going to share it again. I want you to have a look at this before I go. Okay. Now, no, it's a bit bigger. Hang on, that's a bit too big. And okay. Get out my pen. Okay. So now, the exam is being run, and all the English exams are based on the CEFR, Common European Framework on Language. Yeah, A1 to C1. So for a B, which is 350 to 450, A 450 up to 500. A up to 500, 452 to 500 is basically native ability, which is quite hard. But a solid B, you're looking at C1. So it's kind of B2, C1, upper intermediate, heading to advanced. Okay. Now this table, you can find it on the internet. I can post it in Telegram. This shows you what you have to basically do or be able to do or to use to be considered upper intermediate. Advanced. Now, as you'll see, certain functions, what you can do in English. So, for example, you have to develop an argument systematically. Now, this is one reason why you had to take the IELTS test and why the IELTS test had an essay. Because to be an upper intermediate advanced user of English, or indeed French, German, etc., you have to be able to logically and systematically develop an argument of a set of ideas. And if you look at this, synthesize, evaluate, and gloss information, which is basically kind of what you are doing or should be doing when writing a letter. You have to synthesize, be able to put information together, which is what you are doing in a letter, evaluate what's pertinent, what is not, and gloss, put it into a logical sequence. So, these are the functions that are being tested, apart from the grammar and vocabulary. But still, starting with functions at first, this is what you have to basically do, which is why you had to write an essay, but now they've changed it. But even though it's a letter, you still have to logically construct a narrative, logically link you have to pick the information, evaluating, put it together, synthesize it, and develop it systematically. Now, if we look at grammar, what do you have to do? Well, you have to be able to do these, and basically all these as well. So, phrasal verbs, all forms of passive, narrative tenses, because it's a story. Futures, mixed, conditionals, though you probably won't use much of these in the letter, which is why it's easier than writing an essay. But still, future continuous, future perfect, modals of deduction and speculation. They're good. Narrative tenses, again, because it's a story. Past perfect, continuous. You've got to be able to use these if you are B2 or C1. In terms of vocabulary, idiomatics, formal and informal, which is what you are being assessed on. Yeah. Approximation, etc. So, and of course, linking. This is, what it means by discourse markers is words or phrases that connect your ideas. So you have to be able to use formal and formal tone here because it's a letter, but your discourse markers to structure and signpost formal writing. In terms of this medical history, initially on today's visit, therefore, thus, etc. So this is why you've got to be able to use these. Yeah? Anyway, that's enough for now. I'm going to be off. What's this? Someone's got a question. Can I write urgent, immediate to paraphrase ASAP? I just say, well, yeah. Can I urgently requesting, immediately, you can use either of those. So I'm going to end this now. I'm going to put this video on YouTube and post the link in the group on Telegram. So I'm going to have another session tomorrow. So if I haven't done anybody's letter who's taking this weekend, if you post it in the group and mark it for my attention, I might be able to include it for tomorrow. Okay, so I'll stop this. I'll be in Telegram for a while. I'll see you later.